Think of a catatonic patient in a movie or a television show. You're likely picturing someone frozen in place, a human statue appearing entirely disconnected from the bustling world around them. This image resonates because it aligns with a common misunderstanding: the idea that when a mind is overwhelmed by severe psychological trauma, the physical body simply powers down in response. But that cinematic portrayal is a fiction. Catatonia is a transient state, and characterizing it as a simple shutting down misses the complex biological reality of the condition. Relying on this myth is dangerous. When we expect a patient to look like a statue, we fail to recognize the actual signs of an acute medical crisis that requires immediate intervention. Moving past the myth of permanent paralysis allows for the accurate recognition of a treatable emergency, ensuring that a patient receives help before their physical safety is compromised. Medically, catatonia is defined as a severe disruption of the body's movement and responsiveness systems. It is a failure of the brain to properly regulate physical action. This scale illustrates the spectrum of disruption. On one end are traditional symptoms: unnatural stillness, lack of speech, and rigid, unusual postures. Yet, catatonia frequently manifests at the opposite extreme, characterized by restless, agitated, and excessive movement that appears entirely purposeless. While these behaviors look contradictory, both stem from the same catastrophic failure in the neurological pathways that regulate and sequence motor control. This disruption rarely happens in isolation. It typically surfaces as a secondary symptom, triggered by underlying mood disorders, psychotic episodes, or other acute medical conditions. Ultimately, catatonia is a profound breakdown of the mind-body connection, serving as a physical alarm bell for a much larger systemic crisis. Witnessing a catatonic episode means managing an environment where the stakes are high. The patient may be unresponsive to environmental hazards or moving with such agitation that they risk immediate physical injury. These episodes are acute medical emergencies. They require immediate intervention rather than a wait-and-see approach. If physical safety is compromised, the mandatory first step is a 911 call or an immediate trip to the nearest emergency room. During this volatile phase, only a licensed medical clinician is qualified to accurately diagnose the syndrome and distinguish it from other neurological events. Treatment follows a strict hierarchy of needs. Physical medical stabilization must always be achieved before long-term psychological therapy can be introduced. Once that stabilization occurs, the clinical reality diverges from the myth of the frozen patient. When provided with prompt, appropriate care, the syndrome typically responds well to treatment. After the patient is medically stable, the focus shifts toward the underlying conditions. Clinicians begin the work of addressing the mood disorders or trauma that triggered the episode. Stability in the wake of a crisis provides the necessary foundation for a structured, hopeful recovery. For those in Georgia, navigating that long-term recovery requires a professional team, which is where coping and healing counseling provides the essential next step. CHC is a 100% HIPAA-compliant telehealth practice, ensuring that patients across all 159 Georgia counties have access to secure, professional support. Their team includes over 15 licensed therapists, offering a diverse, culturally competent staff equipped to handle the trauma, grief, and anxiety that often sit at the center of these crises. To keep care accessible, CHC offers a $0 copay for Medicaid and affordable $10 to $40 sessions for major private insurers, including Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, and Humana. You can begin your continuity of care by calling 404-832-0102 or visiting chctherapy.com. A catatonic episode may momentarily disrupt the connection between mind and body, but with the right professional team, a patient's journey toward recovery remains continuous and hopeful.